Good morning. Firstly, I'd like to acknowledge the traditional owners of the land upon which we meet and pay my respects to elders past and present and of course emerging. It's a difficult thing to come up here after Cameron. I took a lot of notes during the course of that particular presentation, but what really rang true for me are some of the things I'm going to talk about in this Express post. So first I want to talk about the role of the Commission. We're still talking about it. We were established 4 years ago to drive reform towards a more integrated, evidence-based, recovery-orientated mental health and alcohol and other drug service system. That's not just about the health system. That's about housing, education, employment, justice, child protection, a whole range of systems and services that people access in their everyday lives. What's important about what we do is what it means for Queenslanders. So our aim really is to improve the mental health and wellbeing of all Queenslanders and prevent and reduce the impact of mental illness, problematic alcohol and other drug use and suicide. And it's not, as you can imagine, a small job. And we've drawn this diagram. It really is aimed to help people understand that mental illness is not the same as mental health and wellbeing. And actually, after hearing Cameron, that's pretty much the focus we take in relation to problematic alcohol and other drug use, and I'll get into that shortly. So mental health and wellbeing is different from mental illness, as I indicated. It's about everybody's ability to realise their own abilities, realise aspirations, contribute to the community and work productively. It's influenced by a wide range of factors, so issues within families, employment, poverty, homelessness, and in this context, it both influences and is impacted by problematic alcohol and other drug use. So what we do know is that around 17.5% of people living who use illicit drugs also experience high or very high levels of psychological distress. Now, psychological distress is not actually a mental illness, strictly speaking, but it's an indication about people needing to get some professional help in relation to how they're feeling. And after hearing Cameron today, the advice about CBT, diet, sleep, exercise and water, I would throw into that social inclusion as part of a way through recovery. The conversation we're having this afternoon that I'll be a part of is focusing on child protection, so I wanted to have this slide up. We all know that there's a need to ensure that children and young people get the best start in life, and that functioning families are fundamental to good mental health and wellbeing, not only in the early years but well into life. And our focus is really on supporting parents and caregivers to provide a nurturing family life. Systems and services need to respond and help families and caregivers in that role, but also to identify and respond when the first signs of problems exist. So that's not necessarily a problem that's a mental illness problem or a drug use problem. That's just noticing if someone's not feeling particularly well. With reducing the impact of problematic alcohol and other drug use, this is across all drug types. So our role is to work across government to address the socioeconomic determinants, so those things that Cameron talked about that exist outside of the health system but are fundamental to the lives of Queenslanders and play a really important role in prevention but also in recovery. We also have a focus on connection to community. So reducing stigma and discrimination, ensuring that people are able to stay connected to their families, the broader community, are able to get a job, are able to have a productive life and live a life with purpose. More recently, we travelled around the state talking to Queenslanders about how do we improve mental health and wellbeing and also reduce the impact of problematic alcohol and other drug use. We didn't focus specifically on ice, which was actually a good thing. Most communities identified alcohol as the primary issue in their community. Obviously, there was some talk about ice, but I think that's an important point to make. And what we heard was that the stigma can actually impact on recovery, but also people seeking help. And in relation to children and families, it was twofold. So families not seeking help for fear for their own issues with drug and alcohol, for fear that their children will be taken into care. So the longer they don't seek help, the worse the problem gets, and the more likely it is that a child will be taken into care. And families of children experiencing AOD issues actually not seeking help for fear that they will be branded as bad parents. And the other part of that is actually not knowing where to go. So in the more regional parts of the state, they're not really being a whole set of supports in that community. And obviously the smaller your community is, if you're turning up to a hospital, your confidentiality is actually an issue. In relation to, I'll skip through that slide because it's kind of going to be my answer in the next panel. I think that in Queensland, the focus on ICE, as Cameron says, has got some real risks, but also some real opportunities. Just listening to what Cameron said around Victorian models of safe injecting spaces, I think there are some real opportunities in Queensland to look at our service system as a whole, looking beyond health and looking beyond a mental illness framework. When people are experiencing a mental illness, obviously there's a need for those services to be in place. But where there is no mental illness, we actually need to have that middle ground space where people are able to receive the support they need while they are going through their recovery. So I think there are some really big challenges ahead in Queensland, but also a good deal of opportunity. And I'm really looking forward to the panel discussion this afternoon. Thank you.